Good afternoon. Mr. Manoj Nair from the ET Edge, all our eminent doctors who've traveled from all parts of the country here today for this very important conclave, other members of ET Edge team, and other distinguished guests, ladies and gentlemen. Well, it gives me great pleasure to join you all for the 5th edition of the Economic Times Doctors' Day Conclave. I have addressed one of the earlier editions also in the past when I was the Minister of State for Health and Family Welfare. And today, of course, I have a different portfolio altogether, commerce and industry. But even today, I couldn't have missed this opportunity of coming and meeting so many of you who are traveling from all parts of the country and doing a wonderful service to the nation, to the mankind. It's my honor, it's my privilege to join you all on this very special occasion of Doctors' Day. Being here with you means a lot because we have a dream for a self-reliant India. Dream to see India self-reliant in the next 25 years by 2047. And we believe that only a healthy India can be a self-reliant India. So the journey of self-reliant India could never be complete without our doctors. So I'm glad to be here. And I really mean to say that you're doing a great job by not just curing illness, but also contributing towards this vision and this dream of the Honorable Prime Minister of India, Shri Narendra Modi ji. There is a tremendous amount of commitment, sacrifice, dedication, which goes into being a good doctor. And Doctors' Day is truly one of the days where we could make a small effort to recognize your invaluable contribution to the society. You've come up as true warriors even in the very, very difficult times of COVID pandemic. So many of our doctors even lost their lives while trying to save their patients. And no words could ever be enough to express our gratitude to all those who've lost their lives in trying to save so many citizens. Today I stand here to express our thankfulness, and millions of Indians feel the same, indebted and grateful to our doctors for curing our illness and also bringing health and happiness to our lives. A doctor's healing touch means a lot. More than the medicines, more than the surgeries, more than anything else. It is what the doctor says and how a doctor treats his or her patient, which has a tremendous impact on the recovery of any patient. So today, I once again congratulate all the doctors who assembled here. A very, very happy Doctors' Day. We have an apt theme for discussion today. Healthcare agenda. Health and wellness for all. We believe success and riches can only be built on the foundation of good health, whether it is the health of an individual, a society, or a nation, or the whole world. And this is the reason why health has always been the topmost priority of the government led by Prime Minister Modi ji. In the course of these 8 years, recently, just a few days back, we were holding events across the country, in different states, different cities, talking about our achievements in these 8 years of governance, where we also spoke about health. And so many miles that we have traveled in making the healthcare systems better than before in these 8 years, and the journey still continues. We have to remember here the Sustainable Development Goals, the SDG 3, which primarily addresses health. In 2015, when the different countries of the world came together to adopt a health agenda, the SDGs 3, they decided to set a target for universal health coverage, when no one is left behind, and India was a party to it. So it was not just a commitment at an international forum which could just be said and not taken care of later on. India showed its commitment and took steps in the right direction. It was in 2017 when we launched the National Health Policy, after a gap of many years. And while we launched the National Health Policy in 2017, we came up with a very big initiative which was much appreciated globally also, the Ayushman Bharat initiative. Ayushman Bharat initiative is intended at universal health coverage. When we launched it, it had 2 pillars. But later on, 2 more components or 2 more pillars were added to it. The first component was of PMJ, under which we assured our poor patients, 10 crore families, so if 5 members on an average in a family, then 50 crore people, a health insurance of 5 lakh rupees, to make sure that nobody is devoid of treatment because of lack of money, because of poverty. That was one very important pillar. The other was, of course, in the form of the health and wellness centers. We've been having our primary health centers, sub-centers in the rural and urban areas for very long. How to make them more impactful? How to make them centers where most of the primary services, healthcare services, are available to citizens at large. So these sub-centers and primary health centers were transformed into wellness centers. And these wellness centers became a near home and also an at home. This kind of an arrangement for treatment was made with the help of these centers. These wellness centers made sure that the distance between a patient and his or her doctor becomes less than, say, about 30 minutes. And also we have facilities like telemedicine today. You sit at home and you take the consultation of a doctor. We have to make it more advanced. We have to increase its approach. But these are the things that we have come up with. Along with this, in times we added 2 more important components. The third one being the Ayushman Bharat Digital Health Mission. Because we've realized over time that digital health solutions in the health ecosystem, they have immense benefits. In COVID times, we came up with Cowin, Arogya Setu, e-Sanjeevani. All these digital solutions prove to us that technology can play a big role in increasing the accessibility of healthcare and treatment. Which is why government realizes the significance of every individual having a health card, like an Aadhaar card. So all the information which is related to any individual regarding his health would be stored in a card, and it could be readily available to any doctor in any part of the country or the globe who is attending to that particular patient. So entire history would be there. And we are gradually strengthening our move towards digital health solutions. The last and the most important pillar relates to infrastructure. Because one of the very important lessons which COVID-19 pandemic taught us and taught the whole world was that we need increased spending in the healthcare infrastructures. Everything was brought to a standstill. We realized that the need was much bigger. And there is so much that we still need to do. So the biggest ever initiative, costing 64,000 crores over a period of 5 years, which would be towards improving the health infrastructure across the country. The Ayushman Bharat Health Infrastructure Mission, that was announced. So in times to come, we'll see BSL-3 laboratories, we'll see regional virology institutes, or we'll see the critical care blocks in every nook and corner of the country. That was the kind of approach we adopted by way of this big whole umbrella initiative called Ayushman Bharat. You've seen the journey of this government over 8 years. And a lot of work has been done before the pandemic as well. Whether I talk about the reduction in the cost of the drugs for cancer or diabetes, or the initiative for setting up dialysis centers on a PPP mode in the district hospitals, the availability of affordable generic drugs, medical devices, parks coming up in the country, also increasing the number of medical colleges, improving the medical education scenario in the country. So we moved from 387 medical colleges in 2014 to some 596 medical colleges in the year 2022. We had as many as 6 All India Institute of Medical Science in the year 2014. This number rose to 22 in the year 2022. That is the journey of how to increase the number of doctors, how to increase medical colleges, All India institutes, improve the doctor-patient ratio. I also take pride in the fact that India became the largest producer of the generic drugs. It is called the pharmacy of the world. And there are high-quality drugs that India has been supplying to more than 200 countries. Medical tourism has been increasing. And health as a subject, I would say, is not something which is only related to the Health and the Family Welfare Ministry. When we speak of the characteristics of the governance regime of Prime Minister Narendra Modi ji, one of the very important aspects is that we look at a problem holistically. We make a root cause analysis. We look for long-term solutions and not short-term gains. So health also has to be looked at more holistically. The initiatives or the schemes or the programs that I just spoke about a few minutes back pertain to the health ministry. But we have a lot to do beyond the Health and Family Welfare Ministry. So if I talk about initiatives like the Clean India Mission, the Swachh Bharat Abhiyan, as doctors you would understand how poor sanitation or lack of cleanliness or poor hygiene has a strong relation with disease or illness or poor health. So which is why we brought in the Swachh Bharat Abhiyan, cross of toilets built across the country. We brought in a scheme of Ujjwala. We don't want the women from the poor households to suffer from many diseases on account of the smoke that they take inside their body while they make food on a traditional chulha. So there are several such initiatives across several ministries. all of which, the Poshan Abhiyan, for example, the WCD ministry, Women and Child Ministry, everything put together is actually aiming at better health, a healthier India. We made efforts towards giving more recognition to our traditional Indian medicines. You know how the value of Ayurveda is being recognized today across the world. The increase in the number of Ayush dispensaries, hospitals, colleges. And if we talk about the preventive aspect of health, then I think no leader other than our Honorable Prime Minister has been a champion in promoting yoga all over the world. Today, 177 countries are practicing yoga. We just observed the International Yoga Day on 21st of this month. This is the 75th year of India's independence. We call it Amrit Kal. So 75 iconic locations were identified across the country. We all went, all members of the Union Council, we went to 75 different locations. And we followed the common yoga protocol, and so many countries across the world, all of us, we were trying to do it together. A guardian ring was created. With the movement of the sun, yoga was being performed in different countries. So all this to give a strong message to the whole nation that the curative aspect of the health comes later. First comes the preventive. We all can do so much on our own to make sure, I know that's not a good thing to say to the doctors, but I'm sure you also must be saying this to the patients, that keep yourself healthy. Lifestyle diseases are rising. So much that we can do at our own end to remain healthy. So it's a huge effort, it's a collective effort, and it is a holistic approach, which our government is making to ensure that the entire continuum of care, preventive to curative to rehabilitative to palliative, everything is taken care of. Health becomes not just accessible, but also affordable, and also quality at the same time. When we rolled out the National Health Policy, these were the things that we paid attention to. That health has to be quality health. Health has to be accessible for all. No one is left behind. And health has to be affordable. And so is why so many of our initiatives came in this direction. So this is the mantra that a healthy India can only be a self-reliant India, which we are moving ahead with. And I always say that this journey, I repeat, could not be complete. This dream cannot be realized without the contribution of our medical fraternity. So not much. I would once again thank you all for coming here, making this day even more special. Once again, congratulations to you. I hope you continue to do the good work that you've always been doing. We express our gratefulness and wish you all a very happy Doctor's Day once again. Thank you, E.T., for calling me here and giving me the opportunity. Thank you very much.